Hello, I am Mohammed. I am a psychiatrist. Today I am going to talk about a major psychological problem or a major psychological disorder. I am going to focus on major depressive disorder. Few days ago, Mr. SpongeBob, a 24 years old male, came to my office. He was complaining about his depression, which is lasting more than 2 weeks. He told me he lost his appetite, continuously losing his weight, and he also told me he has an upcoming examination but he cannot concentrate to his study. He also told me that he cannot perform his everyday household work properly. He also got suicidal tendency, and this kind of problem hampering his relationship with his friends and family. So I asked him about his physical condition. He told me last physical checkup there was no abnormality and he has no history of any medical condition. So my diagnosis say that Mr. SpongeBob is suffering from major depressive disorder. So I planned treatment for him. I planned for psychotherapy and medical therapy. Psychotherapy means talk therapy and medical therapy means biomedical therapy. In talk therapy, my goal is to replace his negative beliefs, feelings and thoughts into positive one. And I also help him to cope him with the everyday challenge of life because he got suicidal tendencies. I have chosen talk therapy because it has some advantages. The most advantage is in psychotherapy you are not going to use any drug, so there is very little chance of side effect. In addition, uh, you there is some people who does not respond in medication, so psychotherapy is very effective for them. There is also some disadvantage of this kind of treatment, like it's take typically long time, and another disadvantage is if the person has severe depression, most of the time psychotherapy doesn't work. And I have also planned for medical therapy. In medical therapy, I am going to prescribe Mr. SpongeBob some anti-depression medication, SSRI. SSRI means selective serotonin reuptake inhibitors. This SSRI medication is going to help. Actually, it's work like it inhibits the breakdown of serotonin in the brain. It means that serotonin, this kind of neurotransmitter, is going more into your bloodstream, and serotonin is going to help to improve your mood, and it will also provide a good sleeping pattern. So it will definitely help Mr. SpongeBob. The advantage of this kind of treatment is The SSRI have very low level of side effect. So SSRI have very low level of side effect than other antidepressive medication. There is also some disadvantage of medical treatment like SSRI treatment. It has some side effects. Most side effects is like nausea, vomiting, headache, and um, sexual desire can be low. But this kind of treatment is going to help Mr. SpongeBob. So I feel major depression is not a critical problem, and my treatment is going to help Mr. SpongeBob to back to his normal life. Thank you.